Zebutal is a combination medication that is used to treat tension headaches. It contains acetaminophen, which helps to decrease the pain from the headache, and caffeine, which helps to increase the effects of acetaminophen. It also contains butalbital, which is a sedative that helps to decrease anxiety and cause sleepiness and relaxation. It's important to follow the recommended dosage and take it as directed by your doctor. It is usually taken every 4 to 6 hours as needed for pain. It's important to not exceed the recommended dosage, as it can lead to serious side effects. Always consult with your doctor about the best time to take this medication. When taking Zebutal, you should take it by mouth with or without food as directed by your doctor, typically every 4 hours as needed. If you are using the liquid form, make sure to measure the dose carefully using a special measuring device or spoon. The dosage will depend on your medical condition, age, and how you respond to the treatment. This medication works best when taken as soon as you start feeling a headache. If you wait until the headache has worsened, the medication may not work as well. If you suddenly stop using Zebutal, you may experience withdrawal symptoms such as nausea, vomiting, mental/mood changes, or seizures. To prevent withdrawal, your doctor may gradually lower your dose. Withdrawal is more likely if you have been using this medication for a long time or in high doses. Although Zebutal helps many people, it may sometimes cause addiction. This risk may be higher if you have a substance use disorder. Take this medication exactly as prescribed to lower the risk of addiction. If you notice increased use of this medication, worsening of headaches, or the medication not working as well, talk to your doctor. They may need to change your medication or add another one to prevent the headaches. Some common side effects of Zebutal include nausea, vomiting, abdominal pain, constipation, dry mouth, shaking, shortness of breath, increased urination, lightheadedness, dizziness, drowsiness, and trouble sleeping. To reduce the risk of dizziness and lightheadedness, it's important to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, if you notice any serious side effects such as mental/mood changes, fainting, seizures, or fast/irregular heartbeat, be sure to contact your doctor right away. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. As for the best time to take Zebutal, it's important to follow your doctor's instructions. They will determine the appropriate dosage and timing based on your individual needs and medical condition. If you have any concerns or questions about taking Zebutal, be sure to discuss them with your doctor. Acetaminophen is one of the ingredients in Zebutal. It's important to not take more than 4,000 milligrams, 4 grams, of acetaminophen a day, as taking too much can cause serious liver disease. If you have liver problems or are giving it to children, you should take less acetaminophen. It's best to ask your doctor or pharmacist how much acetaminophen is safe for you to take. Make sure to check the labels of all your medications to see if they contain acetaminophen, as it is found in many over-the-counter and prescription drugs for pain, fever, and cold symptoms. It's important to not take any other drugs containing acetaminophen without consulting your doctor or pharmacist first. If you take too much acetaminophen, seek medical help immediately, even if you feel okay. Overdose symptoms include nausea, vomiting, loss of appetite, sweating, stomach pain, tiredness, yellowing of the eyes or skin, and dark urine. Daily alcohol use, especially when combined with acetaminophen, can harm your liver, so it's best to avoid alcohol while taking Zebutal. Before taking Zebutal, it's important to let your doctor know if you have any allergies to acetaminophen, caffeine, or butalbital, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor, especially if you have breathing problems, liver or kidney disease, or a history of substance use disorder. Zebutal may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or operating machinery until you know how this medication affects you. If you have diabetes, alcohol dependence, or other specific conditions, talk to your doctor about using this product safely. If you are an older adult, you may be more sensitive to the side effects of Zebutal, such as drowsiness and trouble falling asleep, which can increase the risk of falling. If you are pregnant, discuss with your doctor the risks and benefits of using this medication, as it should only be used when clearly needed. It's also important to note that this drug can pass into breast milk and may have undesirable effects on a nursing infant, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Zebutal, as they can affect how other medications work and increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor first. There are several products that may interact with Zebutal, such as darunavir, sodium oxybate, isoniazid, ketoconazole, and others. This drug can also speed up the removal of other drugs from your body, which may affect how they work. It's important to tell your doctor or pharmacist if you are taking any other products that cause drowsiness, as well as checking the labels on all your medicines for caffeine or ingredients that cause drowsiness. It's important to note that Zebutal may decrease the effectiveness of hormonal birth control, so it's important to discuss with your doctor if you should use additional reliable birth control methods while using this medication. Additionally, this medication may interfere with certain medical/lab tests, so make sure that lab personnel and all your doctors know that you are using this drug. If you or someone else has taken too much Zebutal and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents should contact a provincial poison control center. Symptoms of an overdose may include excessive drowsiness, slow/shallow breathing, severe dizziness, nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. If any of these symptoms occur, seek medical assistance right away. It's important not to share Zebutal with others, as it is prescribed specifically for your condition. If you experience tension headaches, you can also try massage, hot baths, or other relaxation methods to help alleviate the pain. Make sure to consult with your doctor or pharmacist for more information on these techniques. While taking Zebutal, your doctor may conduct lab and/or medical tests to monitor your liver and kidney function. It's crucial to attend all of your medical and lab appointments to ensure that the medication is working effectively and not causing any harm. Be sure to consult your doctor for more details regarding these tests and appointments. Zebutal is a combination medication used to treat tension headaches. It contains a combination of butalbital, acetaminophen, and caffeine. Butalbital belongs to a class of drugs called barbiturates, which work as central nervous system depressants. Acetaminophen is a pain reliever and fever reducer, while caffeine is a central nervous system stimulant. This combination medication works by relaxing the muscle contractions in the blood vessels and improving blood flow to the brain, which helps to relieve tension headaches. The usual adult dosage is 1 or 2 capsules every 4 hours as needed. It is important to follow the dosing instructions provided by your doctor. Zebutal should be taken with a full glass of water to help prevent stomach irritation. It is best to take this medication with food or milk to minimize stomach upset. Be sure to avoid taking more than recommended, as it can lead to liver damage and other serious health problems. It is important to take Zebutal at the first sign of a headache to achieve the best results. Make sure to store Zebutal at room temperature, away from light and moisture. It's important to keep it in a place where children and pets cannot reach it. When it comes to discarding the medication, don't flush it down the toilet or pour it into a drain unless you have been specifically instructed to do so. When the medication is expired or no longer needed, be sure to consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.